Hello friends, greetings from our clinic Bodysculpt. Today we are going to start off a case of FUE hair transplant for a grade 2 alopecia. The patient would require somewhere around 3000 grafts plus for his areas in the front. He also wants some touch-ups for his crown area, which we might be adjusting at the end of the procedure. The patient is coming here for his transplant because he wishes to get married and is pretty young in age. For the procedure, we've explained him it will be around 6 to 7 hours procedure with his breaks included for lunch and all those things. He'll be conscious throughout the procedure. It will be a painless procedure, and the technique which we use, we make sure that there's least amount of bleeding. We have some special steps during the procedure, during the surgery for that. Now, after trimming of his hair, we have again marked how our site would be. Then we assess his donor site for the amount of grafts available. This area we would be giving just a few touch-ups wherever we feel there are fewer lesions. Otherwise, if you see his recipient site, this is a very weak site. This is almost a loss of most of the area. We might transplant some hair in this area, and we would be taking care to preserve most of these hair which are existing at the moment and then implanting in between these. We have some irregularities created in his hairline to give a more natural appearance. Now we'll be taking him for the anesthesia after seeing his blood pressure once again. Once we are sure he's settled down on his blood pressure and his pulse rate, we make him lie prone on his stomach. And in this position, we first of all see his place where we need to give some local anesthesia. Once this is marked, we put some ice packs which deliver a lot of cold, I would say, temperature to this skin to numb it before we give some anesthesia. Can you feel any pain now?
No.
That is the magic of this ice packs and the special solution which we make. So we've numbed most of his head. So we'll be waiting for some time till his head gets numb further. And then we'll be starting off the procedure for extraction of grafts. And accordingly we select our punch as well. Once we're sure we have a reasonably good amount of grafts coming out, we mark our donor site. The donor site is marked depending upon the direction of hair. These are the grafts which we are able to harvest. I'm just checking for pain, okay? आप मुझे दोबारा बताएंगे कहीं पेन हो तो. Pain, 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 pain. Now, now, now. Good. So now after designing the hairline, we are planning for a PRP right now. We took the blood sample of the patient right away, and now we have got the PRP ready in our kit. This is the first draw which we've taken. So we are now injecting the PRP. So we are using this for the frontal hairline. So the PRP is through. Now we'll be turning the patient prone, and we'll start harvesting the grafts. So now I'm getting scrubbed for the post-lunch session. The patient is already taken in after the lunch. He's lying down comfortably, and now we are going to harvest some more grafts. I'll be doing the punching for his left temporal area, and we should be able to harvest around 1,000 grafts from this side as well. Now we are doing the punching for the left temporoparietal area. These grafts have a different angulation and different depth as compared to the occipital area. The advantage of doing it in various settings is, number one, the grafts are lying within the body for longer time and are outside the body for shorter. Secondly, we have the patient lying comfortably on his lateral side as compared to the prone position, which is a bit more difficult to lie down in. Almost 4:30 now, and the patient has been awake the whole procedure, and hopefully he hasn't undergone any sort of discomfort during the procedure. We'll ask him directly how it is. Manish ji, how do you feel about procedure? अब तक कैसा लग रहा है आपको?
बिल्कुल ठीक था, कोई भी मेरे को दर्द नहीं हुआ. Very nice, means comfortable था सारा प्रोसेस.